Let's see what we can help with.
I've been trying not to like pop
anything.
Save it. I know. I'm like every little joint I can feel when it's like needs to go.
Are you a self-adjuster?
Yeah, unfortunately, but I do it multiple times a day. I know I shouldn't,
but well, you have some problems.
It just gets so tight. It's like that's what you find relief when it goes a little bit.
Okay. Yeah, I mean, I understand. I'm in this business, so I
understand. You understand.
All right, so explain to me then what you're feeling with the left shoulder.
It's been about 3.5 years. So I was interning, so I was having to do like probably 2 or 3 fitness classes a day. I was working out myself, and I started noticing about like right in my rear delt, it was getting a little achy feeling. And I was like, well, I'll push through it. Like, it'll be fine. Well, one day it just kind of went. I mean, nothing, I had MRIs, nothing tore, but to the point where I couldn't lift my arm above my shoulder. I was in a sling for 3 weeks, I think. Went to 2 physical therapists. Nobody could really, like, everybody said, like, scapular dyskinesis is what they said.
But they didn't see anything on an MRI.
No, and it really, like, the point right there on my scapula, I feel like it
is the most
almost sore. Like when I work out, like my arms go above my head and down, or my arms are away, it feels like it just grinds into the muscle. That's how I can explain it. It feels like
Do you hear like clicking?
A little bit.
Okay, so explain to me what exactly the motion was, if you can remember what the motion was when you went out.
I was doing rear delt flies like on the machine, so my arm was away and I was pulling back.
So you're pushing your back, and you felt something pop. You heard something.
No, it wasn't pop. It's like I lost all strength. It's like my muscle just like weakened. Like
okay.
Yeah, and it's been 3 years, and I can work out, but it's taken those 3 years to be able to, like, still I can't do a pull-up to where I used to be able to do, like, 8 or 10, and it still swells a little back here. Like, it used to look like a golf ball. Like, when it would swell, I mean, it would just, and it's always right here.
Oh, okay, so it would turn face that way. Just so I can feel this a little bit. When it first went out.
It was right here.
Oh, it was right there.
Yes, it was right there. I felt like I had tennis elbow. It would go down to my wrist, my bicep. They were thinking I had a bicep tear for a while because it would stay so inflamed, like through my chest and down my arm. It doesn't swell as much now or get as irritated, but it just stays tight.
Okay. And then the low back, sacrum.
Yes. Recently, 4 months ago, I just had something in my car, and I have your typical like lower back pain occasionally, but I had a plate and I was in my driver's seat and I turned to twist to sit it down, and immediately it felt like something just tore. I mean, and I looked at myself and the blood just rushed out of my face. I was wide. I was like, I'm not going to be able to make it in this house. I mean, I drugged myself in the house.
I'm sorry.
Got in the bed, and I laid in the bed for about 4 or 5 hours. Could not stand up. Finally, like, my chiropractor was like, if you can make it, like, please come in. Now, like, I have to be very careful.
With how you...
I teach yoga, and I'm training all day, so I'm bending over, picking up, and it's still... And I'll show you where, like, right... here is so sore still.
The center of the sacrum.
Like when I lay down and like.
All right, go ahead and just turn your feet, like turn towards the white wall. I'm sorry.
Oh, like flip.
Yeah, flip over. Okay. Yeah, let me see what you're talking about here. Go ahead. So right here.
It stays extremely sore, like almost bruised feeling, and that's been well over 4 months.
Oh, look at that though. There it is. Which way did you turn again? This way?
Oh yeah, I feel
that. Yeah, it's still there. Look at that. Look, yeah, can you feel it? Here it is. It's like a little ligament right there. Feel it?
Yeah.
Yeah. Now feel the other side. You always feel the good side. And then you go to the bad side and see, you know, you feel that little ligament.
Yeah.
If it's right where you're pointing,
Yeah.
lateral to where you're pointing.
Well, and
right there.
It's usually I have issues on my left side, but I do get like that sciatic pain that shoots. Like I'll take a step and it'll go down my glute, like on the right side, and it doesn't on the left side some, but usually it's on the right.
Cross your arm for me. I'm just gonna check.
I mean, I've been told, like, when I first started the chiropractor that I had a slight curvature, but...
Yeah, right here.
Mm-hmm.
To the right, again.
But I was told it wasn't anything.
It's not scoliosis.
Yeah.
You know, it's not like a...
Mm-hmm.
But
my lower back
look at that.
would stay...
Still on the right.
Mm-hmm. Would stay so tight.
Can you lean back at all, or is that too bad?
I feel that on, like, my left SI joint.
Look at that. Do you mind if I lift this up for a second?
No, that's fine.
Right here. So go ahead and just lean back for a second, and then bam, there it goes. It fires here. Well, all right. It's okay. You're all right. You're all right. It's just I got a lot of work to do.
And my
oh man.
Mm-hmm.
Okay, so that might be that scapular pain you're talking about because
it's mostly. I mean, it just like I said, when I do anything like
over the
overhand pull, it feels like it just digs into my muscle.
How about pushing?
Same thing.
Same thing. Okay.
And then anytime, like if I do push-ups and my arms are away, but if I do push-ups and my arms are closer in, it doesn't really bother it.
Anything else?
Okay, so it's been years ago, but I was told I had patella maltracking. I dislocated my kneecap, and then it happened and didn't do anything.
10 years ago?
Yeah, probably about 9 or 10 years ago.
Oh, okay. And so were you cheerleading at that point?
I was. It happened when I was cheering. And I wore my brace, and when I got into more fitness, working out, built my muscles, it never bothered me.
Okay.
But probably within the last 6 months, like my left knee hasn't stopped bothering me. Like it swells behind my knee, like my IT band up, like my TFL and up in here. It's just...
On your back.
Okay.
Let me start there. The knee is easier. It might tell me something about the rest of you. You still think it's not tracking correctly?
Well, it's not so much. I don't feel it in the front or anything. It's just the... Yeah, that part feels okay, but it's just the back where it swells.
You mean in the back?
Mm-hmm.
Oh.
The back, it swells.
Who's diagnosing you?
I'm
sorry. I'm like, there's some misinformation here. Something happened. Yeah. What the heck? Mm-hmm. Okay, patella tracking is usually not... Okay. I don't even know where to start. So right here you're saying it's swollen, correct?
Yes.
Okay.
And like if I go walk...
Does this hurt when I do this?
No, it doesn't.
Okay, this is called posterior drawer, and she has no pain.
No.
So, not the posterior collateral ligament. We don't have any pain in here, but you are tender, correct, in here. Does it feel like something is floating?
No.
Does that hurt?
No, it does. It feels like something. It's kind of like popping when you do that.
On the back?
Yeah. Like maybe like moving. Oh,
yeah, right in here.
Wow.
Okay.
Yeah, that's tender.
I'll tell you what I think it is in a second. Yeah. Any pain here?
It's tender, but it's not painful.
Any pain here?
No.
Is this hurt?
No.
I mean, I'm pushing hard.
Yeah. No,
you should come from here, Linnea. Since she has like this extra piece of bone right here, you can kind of see it, and that's kind of not supposed to be there.
No. I'm weird.
I mean, I don't think it's this. I think what you have, is called what they call a Baker cyst.
Okay.
You heard of that? Yeah. Because it feels squishy in there. All right, it feels swollen, squishy. regardless, what are we going to do about it? What you got to do is usually from the pelvic misalignment. At some point in time, one of these joints was injured. It seems like this one is worse, right?
I can explain it as like when that hurts, everything up here is like.
Because where does a Baker cyst come from? Injury, it's an offshoot, like a little balloon, and it can't drain because it's got it's truncated like a balloon. Like you got this balloon back here, and you have this little tiny tube leading to the joint. It's where the joint kind of, like think of a balloon, and now the fluid can't escape because it's got this tube. Okay, so the way you get rid of it is actually pumping it forward into the front of the knee. And that's something you should not do without medical supervision. Like, please, people try to do this themselves because they're like, oh yeah, it's a Baker cyst. Yeah, who knows if you need somebody to look at it and feel this. Yeah. At the end of the day, it is your low back. If you fix the low back, a lot of this will go away.
I mean, this.
It's just there's the knot right there. Eek. Hi. Hello. Right.
Woo. Gosh, I knew this leg was going to be bad.
Well, it's always worse having somebody else do it for you.
And I even foam roll, and it just.
Oh, but I'm mean.
Yeah.
I can tell where you foam rolled, and we're just going to go right past that. We're going to go past the foam
areas that I don't hold.
No,
hurts.
Because I don't think you hold here.
Woo!
Yeah, you're not like, okay, give this one some attention here. This is from L3, actually, in your back. So I gotta go check L3 on the left-hand side. Cause see, watch. Let's go check the right one just for kicks, okay? Let's just see what happens over here.
Show people I'm not that weak. Like I can take pain.
No, it's not that. It's just it's not over here.
Yeah.
Okay. I mean, I'm pushing.
Yeah, it's not just that you're roll. It's
there's a problem. There's a problem.
So bad.
Yeah. It's okay. There you go.
Yeah, it's definitely.
It's getting better. Hold on. Now it's on the outside of the leg, so I'm going to have you turn face the wall. Let's find it. Oh, yeah. TFL.
Wow.
That's into the...
Yeah, that's
all the hip flexors.
Mm-hmm.
Actually, that's not a hip flexor, excuse me. That's your quads. It's the upper part of the quads. Right, okay. Right here. Okay. Yeah, it's like, see, she's got, it's just a swelling here. It's not very bad. It's just really right here. You can just see it. Whereas here it's all nice and toned. And here she's got this little swelling here, and that's that Baker cyst. Pull, good, and relax. And again, pull, good, pull. They're all healthy. You know what I mean? I'm testing them all the way down. No, there's only two things that I found. You got fluid here in the lateral meniscus and fluid here behind the knee. So what do? You come in here, you squish that. Hold on to the table for me, just the front. Yep. Got a right atlas. When was the last time you had a massage?
Like last month.
Okay, that's fine.
I usually go once or twice or every 2 months.
Because I'm just seeing what I've got ahead of me here. Okay, let's adjust it. Okay. I got to get to your shoulder anyway. Chin back for me. Yep, perfect. Very good. That was part of it. Right here. Good. Chin back. Back. I got you. Good. There it is. Yeah. That's pretty good. How are you doing?
Fine. There it goes. I felt it. I was like, it feels like it's about to go.
It's just... You pop your own neck,
I know.
don't you? So it's like, wee! You try to adjust it. It feels so weird. It's like a roller... Because there's a groove that you put in there. I'm going, ooh, along with it.
And my joints do move a lot, so.
No. Everything feels average. Not too tight, not too loose. Here we go. Breathe. Oh.
Pretty.
Yeah. Whee.
It's just super tender in there.
Right here?
Up a little. Yeah, like up in there.
Can't even get in between your shoulder blades. Yeah, she's just, I can't. I mean, is it on that left shoulder?
Mm-hmm.
I'll put your arms on the floor, your hands on the floor. That might let me in a little bit. Right there, there we go. We got a little spot right there on the left. Okay, back up here again. Okay, you're all right?
Mm-hmm.
Just pressure.
Yeah.
I can't get in there. Hold on. Ugh.
Yeah.
That's a weird feeling.
I feel like. Oh.
Well, here it is. Oh, I'm wondering now. That's a little bit fluid filled.
Yeah, that's been there for a while. I feel like it's always.
It feels like a separation. Yeah, you're right. Good. Good. Deep breath in for me. All the way out. Yeah. Good.
Why did that feel so weird?
Yeah, that's
I literally
funny,
felt it move.
Flatten the shoulder out as much as you can. That's it. That's it. Let me in. Let me in. Yep. Deep breath in. Oh, yeah. Yay! Dun, dun, dun.
Yeah, like that still stays really tight. Whenever I hurt my low back.
You just need a lot of work. You just, you're very athletic. You need work, right? If you want energy out of a system, you got to put energy into a system. All right. There's that right lateral curvature. Hi, hello, it's right there. There you go. And down. Yeah, that's a bad one. There she is. Ooh. Lovely. Count this one. Which one is that? And can you see it from over there? Like how high that is?
It is just like protruding out of my back.
Yeah. Whoa. Squish them down, squish them down. Because there's the joint. There's where the rib meets the vertebrae. Come on. That's it. I don't care if it popped. That's just the beginning. If it cavitated. Ooh. This one definitely needs a lot of adjustment. Okay, it's almost quitting on me. I'm sorry. Whew. Oh, I'm behind your back. Careful, there's little bars. Yep. Ooh.
Ooh.
Star. We're gonna use a star. Little red star. Breathe. This is what you came for.
Mm-hmm.
You're like, I'm not so sure anymore.
Mm-hmm. Get in there.
What did I sign up for? Ooh. Superficial. I mean, I had a feeling it was.
Mm-hmm.
Arm down for me. I'm digging out the C in Colossians here. Tuck your chin for me. Oh. Here's another one. We're at the little leaves of the tree now. You okay?
Yeah.
All right. So I'm digging. Oof. So are you the baby?
I am.
I have a feeling. Ugh. There you go. Woo. This side relax, no problem. When do you feel it?
When I'm exercising mostly.
I don't know how to tell. If you did a push-up, would you feel it?
Yeah. Oh yeah, definitely.
Okay, so then can you do a push-up for me?
I can. Yeah.
Please see
On
you.
the ground, you want me to just get?
I just need to see your muscles. I'm sorry. Go ahead.
Okay.
Don't worry about it. I want to see her muscles here in the
I'm
shoulder.
gonna skip back. My head's gonna hit the...
Oh, I'm sorry. Go ahead. I'm looking right here. Okay, that's the way you don't feel it, correct?
That I don't. Yeah, whenever my arms are like closer. But if they're like out, which I don't do push-ups usually when they're out.
Okay.
But anything that my hands, like if I can come closer in, I don't feel it. But if they're anything where my arm is away further.
Put them in again. Place them closer. So like that, you wouldn't feel it.
Mm-hmm.
Now place them out again. Right there, you're still good though at that distance. No.
Yeah, probably not.
I would just do a plank. Do a plank.
Yeah.
Don't do a push-up. Now come in closer. And you're feeling it here.
Mm-hmm. And then behind my shoulder where I said it would swell.
Back in here.
Mm-hmm.
You know, put them wider. Don't actually do a push-up. Oh, okay. And then come in again. Okay. I'm wondering if this is a tear of the long thoracic nerve. And there's some paralysis here.
Mm.
She wasn't a breech delivery or anything, right? No. Because this side, when you do a push-up, it just comes up.
Yeah, no, it does.
And the only time I've ever seen that is when you tear this nerve here. And I'm wondering if maybe that's what happened.
I mean, it, like, around, because at first we thought it was
the shoulder.
Like the frontal or the medial part of the shoulder, and just once the initial like pain and weakness, I was like, no, it is my shoulder blade. Like, it's something. I'm like, I can tell that it's something to do back there.
Linnea, can you look up while I'm doing this? Can you see this? I don't know if you have to come over here or look up long thoracic nerve tear. I'm pretty sure that's what it is. Images? Yeah, I'm pretty sure this is what it is. Yeah. Medial winging. Yep.
Well,
Yeah.
that makes sense.
All right, but you know what? Just come on up and let's test it out. I can't sit here wondering if it is. Let's try like from underneath and come in like this. Now that looks fine.
Yeah, there's certain times where I'm like, certain things that do.
Okay, and now go back again to the push-up. There is a slight winging here.
I can say that.
Yeah, usually this is the scapula that's more prominent, and this is like separated, but it's not bad.
Yeah.
I don't think he injured it like severely, but there might be a little bit of an injury to the long thoracic nerve.
Okay.
And so when you did a delt fly,
it just like went.
Well, now is it? I'm gonna have to do a little bit more research on. No, go back to where the nerve was. So it runs from the neck all the way down and kind of like under the
So
pec.
that would make sense why this stays so tight and swollen.
Yeah, and then it kind of went underneath into here. Wow. Do you ever feel that in your armpit?
It does, yeah.
Yeah.
When I would get massages, she would just like hold there, and I'd be like, oh gosh.
But see, if it's an actual. I need you to find the origin, the branch of it in the neck, where it comes from. Go to Wikipedia. Okay. Just have a seat and face this way. We'll just keep on going.
You know, I told you I was doing extras. He made us like do classes, and I would tell him, I'd be like, my shoulder is hurting, and he'd be like, push through it. And I should have just stepped up and been like, no, I'm not. Like, I'm hurting.
Yeah. See, this comes from like not having a day off.
Yeah. This class, and then this class, and then I'd still work out. And I was just
nerve root. Look, long thoracic nerve root.
I was definitely overtraining and didn't realize it.
Yeah, this is.
I say that this was a blessing and a curse because it did get my mind set to where, like, I don't have to push myself all the time, you know, with exercise-wise.
Cross your arm over like this? Yeah, this is a little bit of a... The good news is it's a peripheral nerve. Okay, peripheral nerves can heal themselves. Okay. If it was at your neck level, like a disc had blown out, can't heal that. Okay. Just put scapular winging injury of the lateral long thoracic nerve.
Yeah, because the MRI, I mean, he was like, he was just for sure.
Well, not here. If they had done maybe up here, C5, C6, C7. Okay.
They didn't do that.
You know, I feel like maybe you popped it out or something got hit. Yeah. So, you know, here I am working here and I see very little problems. But you're going to feel it in here. Yeah, in here.
Oh, yeah.
You know, you'll feel it where all the nerve roots, where they end. Do you see it?
Scapular wing?
Yeah.
Long thoracic nerve root?
Yes. Or just long thoracic nerve. You don't need root.
And that would, like...
It says right here.
Long thoracic nerve originates from C5 through 7 roots and descends into the axilla, posterior to the brachial plexus to innervate the serratus anterior muscle, which anchors the scapula to the chest wall. Okay, so injuries to the long thoracic nerve cause winging of the scapula, especially with the arm in anterior abduction.
It's exactly like when my arm is away from my body.
Okay.
That's exactly...
All right, that's good, babe.
This is like 3.5 years.
You are the only person that's been able to diagnose her.
Been able
she
to
has
give me
went from person to person trying to find out what's going on.
I don't know what just clicked in my head. I've only seen it twice. Oh well, now what? Okay, what do we do? So I think what we have to do is it's almost like treating it like it's thoracic outlet syndrome. A little bit here, okay? Yeah, so you're saying the massage therapist has to hold your serratus. It's not really a big deal, but it just took me a little bit to figure it out. And it's slight. It's not like this huge paralysis. It's just a minor paralysis, so that's what's also kind of, you know, giving you a misreading, you know, kind of. There you go. I know. Woo.
And when I went to one therapist, I would try to explain about my scapula. I was like, but it wings on the side of this, and he was like, oh, that's normal. Everybody has little winging. And I just wanted to
what he didn't understand is that this is the shoulder that normally, the left high shoulder, this is the shoulder that naturally wings, not this one.
Yeah.
So when I saw that, I'm like,
you knew like something.
Well, it's just odd. And then when he did a push-up, this looked like a flat wall, like a bridge. So it's not like it's this huge injury where like you're not gonna lose your. Okay, so how do we fix this? Okay, you have to take the pressure off of the nerve and see if it won't heal on its own. Okay, it drops down into here, the long thoracic, and it goes along here. So I'm trying to go into all of the points Here's your arm. Yeah, like your armpit here.
Mm-hmm.
Kind of like go like this for me. Yeah. You know, and unlock them.
Wow. I didn't know that was sore.
Oh, it's sore on a lot of people. Subscapularis, you know, it's there.
I guess nobody really ever digs right there.
Unless you're here. You have to really love this stuff. And if you're seeing 100 people a day, look at how long that took me. And all the things that, I mean, I have to like kind of sit here and fiddle with it before it really clicks into my mind. There's so many possibilities and variables, but as I'm working on you, I'm going, wait a second, this don't move right. It's slight. It's not like this huge problem. So look, you have something to write down. You need to look that up and look at how to free that, because this isn't going to be enough. You're going back to Georgia and you got to find somebody that'll open you up. Okay, you understand? Like you need to have your arm over your head. Okay, see, even that is like stiff. You understand? Like, can you keep that like that?
Yeah, I can.
But like, it doesn't want to.
Oh, no.
Do you understand? Like, you gotta like, no. On your side, facing the white wall. Head there. There you go. An arm above your head.
And I'm getting laser hair removal under my arm, so I was like, oh gosh, I hope my armpit's
Oh my God.
So it's like a huge like rash under my arms.
Nobody.
And I said, Jesse, nobody's gonna see under your arm.
Fine, we'll turn you this way. We got another tattoo. I found it.
Yeah. So if I went to someone, how would I explain to them?
Long thoracic nerve paralysis,
Okay.
mild.
Okay.
Because they're gonna go, you don't have that.
Yeah.
Yeah, they do.
Yes, that's it.
I was gonna say, write it down for me. So, you go into they go and they Google it and they look up where the heck it goes. Because even I had to look it up. You know, you can only keep so much up in here. But something you said triggered it, and I went, wait a second. Reach babies and
And Jesse.
I don't know, because it usually happens like when they come out like that and they tear everything in here from an injury. So I get it. This is weak, and so the scapula just comes out.
Yeah.
Oh,
Completely makes
fascinating.
sense.
I'm glad it makes sense to you. At first I was like, even I was like, well, I know we said that that's what that was, but like, wait a second, why does that? I'm thinking it's still here. You understand? It's like, no, it's underneath your.
Yeah.
It's crazy because I said, Daddy, why do you want to go to Orlando to a chiropractor? She said, Mama, she can find anything. And look how long she's looked for someone to tell her what her problem is. She's the first person that's done it. She's been seeking for 3.5 years now.
I'm sorry. And why is her scapula wing out? You know, why is not supposed to do that? Yeah, don't you want to know why? I know you want to know why, but as a physician, you kind of think, why? All right, not much there anymore. Woo! Doing okay?
Yeah, I'm okay.
Covered? We're covered. Yeah. Covered for YouTube here. So. There you go. I want it to like kind of open back up again and fix itself, or else it just kind of walls itself off and encapsulates itself, and it doesn't want to like reconnect. So I'm kind of like, hey, wake back up again. So you cause like a micro injury. I'm like kind of pushing hard here, trying to open this little wound back up that your body's walled off. Yeah, we usually see this in like, I'm trying to think of other instances where this would happen. Do they tell you in Wikipedia how this happens? I mean, I imagine like somebody dangling or,
God.
you know, I'm trying to think of somebody else like hanging, you know, gripping, rock climbing, maybe, you know.
Like causes?
Yeah, what causes it? This is like sports doctor. You went to a sports doctor though?
Sports physical therapist. Yeah.
That's odd that he wouldn't know. Or she
And
wouldn't.
he was the one that was thinking my neck.
Yeah,
like
it
nerves,
is partly. You know, it is in part.
But that's as far as, other than that, and like rotator cuff rehabilitation. Well, that's it. That's all everybody wanted to say was it was my rotator cuff.
Yeah, but your rotator cuff, if it was your rotator, would be popping and clicking, and you would have been going. You know, different things give you.
It says it's more prone to injury due to its excessive length.
Yes, it is a long nerve. Okay. On your back for me.
This nerve occurs due to trauma, direct blow to the rib area, or overstretching, or repetitive movements of the arm, or sustained bearing of an excessive weight over the shoulder.
Well, I mean,
No.
It says caused by closed trauma through compression, stretching, or traction.
Okay. All right. Now we know. Pretty cool little nerve, huh? You learn something new every day, Linnea, huh?
Yeah, pretty much.
You're gonna be like an
Pretty much.
expert.
I don't know what I'm looking at.
Looks like a bunch of beef jerky. That's the first thing you think of. It looks like pulled pork and beef jerky when you see the cadavers. You're like,
oh my gosh.
it's all dried out, you know, the tissue. Yeah, I couldn't eat pulled pork for a very long time. Actually, I don't think I still haven't. And even beef jerky.
Like that's the first thing you think of when you go to like pull it apart and you're like, oh no, okay,
Well,
never mind.
So when you see a trapezius, would you think on a cadaver it would be this huge piece of muscle on a person? Like maybe one of the bigger pieces?
Yeah.
It's not. It's like some flap
Really?
on the cadaver. Yeah. Here you work, because it's usually like grandpa and grandma on the table, and their trapezius is really
It's
thin.
like,
So and then you're like, where is it? And they're like, well, most of it got frayed off, but here's this little piece left.
It's like,
and, you're like,
oh.
and that's like every cadaver. The glutes as well, same thing. Glutes are
Wow.
like, because you don't realize how thin they are.
Yeah.
If you don't build them up, they're actually very thin. And that's what beef jerky reminds me of. The gluteus maximus of the cadaver.
Oh my gosh.
It's like I can never look at it the same. I'm scarred for life. It sucks. Like, don't go to med school unless you plan on like becoming a vegetarian at some point in your life. Because you realize, oh God, we all look the same. I can't tell the difference between anything. I mean, calf meat does look a little bit more fatty. I feel like human meat is more lean. Why am I saying this? Let's just change the subject. It's just that's what I'm working on right now, like meat, you know. It's almost tapping out on me. You have to break it down to a point. You don't want to break it off. No, you want it to still give it enough integrity so it can heal itself. Okay. There you go. Woo. Anterior delt. Yep.
Oh.
Okay. Head back, like almost like you're gonna. Yep. Oh, you're tight. Yeah. That's about as far as it goes. Coccyx over here. Very common. Sacral apex to the right. Blah blah blah. Blah blah blah. You okay?
Mm-hmm.
All right, you just let me know if you
Yeah.
plan on doing.
Oh, okay.
Come on up.
Okay.
Is there anything I missed? Oh.
Yeah, I mean, and my shoulder feels like. I mean, I'm not gonna say there's no pain but I mean, I literally don't feel anything right now. Like it feels great. Wow.
Okay, so we're gonna give you homework.
Okay.
So you can find somebody in Georgia to do this to you. It's just opening
Okay.